Proper body cleansing, the key to health and longevity for seniors. Proper body cleansing is essential to maintaining good hygiene, preventing infections, and even prolonging life. As we age, our bodies become more susceptible to pathogens, making daily hygiene care even more important. Here is a detailed guide on how to cleanse the 5 most important body areas to help seniors stay healthy and comfortable. 1. Mouth and tongue care. Health tips for seniors. Oral health has a huge impact on quality of life, especially in the elderly. Poor oral hygiene not only causes tooth loss, but is also linked to many serious health problems such as heart disease, gum disease, and infections. Here are some detailed instructions to help seniors maintain the best oral health. The importance of oral hygiene. As you age, your ability to clean your teeth may decrease due to limited mobility, weakened health, or loss of sensitivity. However, maintaining a clean mouth can help prevent many diseases. Gum disease, gingivitis, periodontitis. Leads to tooth loss or serious infections. Cardiovascular disease. Bacteria from the mouth can enter the bloodstream, increasing the risk of heart attack or stroke. Digestive problems. Weak or missing teeth make chewing and digestion less effective. Effective oral hygiene habits. Brush your teeth twice a day. Use a soft bristled toothbrush to reduce impact on the gums. Brush your teeth in gentle circular motions for 2 minutes. Choose a fluoride toothpaste to strengthen tooth enamel. Floss daily. Remove plaque and food stuck between teeth. Floss gently to avoid damaging the gums. Scrape your tongue regularly. The tongue is often a place where bacteria that cause bad breath accumulate. Use a tongue scraper or the back of your toothbrush to remove plaque. Additional tips. Regular dental checkups, at least every 6 months, to detect and promptly treat problems. Proper nutrition. Eat plenty of green vegetables and fruits. Minimize sugar and highly acidic foods. Drink plenty of water. Avoid dry mouth, especially if taking medication. Maintaining proper oral hygiene habits not only helps the elderly have a beautiful smile, but also ensures comprehensive health throughout life. 2. Armpit care. Tips for maintaining comfort and health. The armpit area is prone to sweat and bacteria accumulation, causing unpleasant body odor and the risk of infection. Proper hygiene will help the elderly feel more confident and comfortable. Wash your armpits daily. Use soap and warm water to clean your armpits every day. Focus on removing sweat and dirt buildup. Consider using an antibacterial cleanser. Choose a gentle product that is suitable for the sensitive skin of older adults. This helps reduce the risk of infection and body odor. Keep your armpits dry. After washing, dry your armpits with a soft towel to avoid creating a moist environment for bacteria to grow. Use deodorant or baby powder if necessary. Additional tips. Regular dental checkups, at least every 6 months to detect and promptly handle problems. Proper nutrition. Eat plenty of green vegetables and fruits, and minimize sugar and acidic foods. Drink plenty of water. Avoid dry mouth, especially if you are taking medication. Maintaining proper oral and underarm hygiene habits not only helps the elderly have a beautiful smile, but also ensures comfort, confidence, and overall health throughout life. 3. Groin and intimate care, preventing infections and fungi. The groin and intimate areas are sensitive areas, susceptible to bacterial and fungal infections if not properly cleaned. This is especially important for the elderly when immunity is reduced. Daily hygiene. Use mild soap or specialized cleaning solutions suitable for the natural pH of the intimate area. Wash with warm water. Avoid using water that is too hot, which can dry the skin and cause irritation. Dry and keep breathable. After washing, dry gently with a soft towel, avoiding strong rubbing. Wear breathable underwear such as cotton to reduce moisture accumulation, creating a natural antibacterial environment. Change underwear regularly. Change underwear daily to prevent bacteria and fungi from growing. Avoid wearing tight clothing or synthetic materials that cause stuffiness. See a doctor. When having unusual symptoms, if there are signs such as itching, redness, unpleasant odor, or unusual discharge, you need to see a doctor for timely diagnosis and treatment. Additional advice, regular dental checkups, at least every 6 months to detect and handle problems promptly. Reasonable nutrition. Eat lots of green vegetables and fruits, reduce sugar and foods with high acidity. Drink plenty of water. Avoid dry mouth, especially if taking medication. Maintaining proper hygiene habits not only helps the elderly feel comfortable and confident, but also improves the quality of life, protecting overall health during the golden years of life. 4. Foot and toe care. Prevent fungal infections and maintain hygiene. Feet and toes are areas that are prone to sweating, creating favorable conditions for bacteria and fungi to grow, especially in the elderly. Proper care will help prevent problems such as athlete's foot and improve overall health. Wash your feet daily. Use mild soap and warm water to clean your feet, especially between your toes. Wash thoroughly to remove dirt, sweat, and bacteria buildup. Chash dry completely. After washing, use a soft towel to dry your feet and between your toes thoroughly. This helps avoid creating a moist environment where bacteria and fungi can easily grow. Wear breathable shoes and socks. Choose breathable footwear that fits your foot size to avoid pressure and injury. Use cotton socks to absorb moisture well and change socks daily to maintain hygiene. Trim toenails properly. Cut toenails neatly. Avoid letting them get too long or too short, which can cause pain or infection. If your toenails are thick or difficult to cut, soak your feet in warm water before cutting. See a doctor when necessary. If you experience symptoms such as itching, peeling, redness, or pain in your feet, see a doctor immediately. Elderly people with diabetes need to pay special attention to foot care to avoid ulcers or serious infections. Additional tips: regular dental checkups, at least every 6 months to detect and treat problems promptly. Proper nutrition. Eat lots of green vegetables and fruits. Reduce sugar and foods with high acidity. Drink plenty of water. Avoid dry mouth, especially if you are taking medication. Maintaining proper hygiene habits not only helps the elderly feel comfortable and confident, but also improves the quality of life and protects overall health during the golden years of life. 5. Ear care, outer and behind. Keep it clean and prevent infection. The ear is a sensitive organ that easily accumulates dirt, sweat, and earwax. If not cleaned properly, the elderly may experience problems such as infections or odors. Here are effective ways to care for the outer and behind ears. Clean the outer ear every day. Use a soft, damp cloth to gently clean the outer ear area. Avoid inserting cotton swabs or hard objects deep into the ear canal to avoid damaging the eardrum or pushing earwax deeper. Care for the area behind the ear. The area behind the ear is also prone to accumulating sweat and dirt and should be thoroughly cleaned with a damp cloth. Dry it carefully after cleaning to prevent odors and infections. Check your ears regularly. If the elderly feel itchy, have ear pain, or have hearing loss, they should see an ENT specialist. Regularly check and remove excess earwax by a medical professional to ensure the best hygiene and health of the ears. Additional advice: regular dental checkups, at least every 6 months to detect and promptly handle problems. Proper nutrition. Eat lots of green vegetables, fruits, minimize sugar and highly acidic foods. Drink plenty of water. Avoid dry mouth, especially if taking medication. Maintaining proper hygiene habits not only helps the elderly feel comfortable and confident, but also improves the quality of life, protecting overall health during the golden years of life. 6. Hand and nail care. Hygiene and disease prevention. Hands are the part of the body that is most exposed to the surrounding environment, easily carrying bacteria and dirt that are harmful to health, especially in the elderly. Here are effective care steps. Wash hands regularly. Use soap and warm water to wash your hands, especially after going to the toilet, before eating, and after contact with dirty objects. Rub your palms, backs of your hands, between your fingers, and nails thoroughly for at least 20 seconds before rinsing with water. Trim your nails neatly. Use nail clippers to trim your nails neatly, avoiding nails that are too long, causing bacteria and dirt to accumulate. Cut along the natural line of the nail to avoid painful ingrown nails. Moisturize and protect your hands. Use moisturizer to avoid dry, cracked skin due to aging. Wear gloves when working with chemicals or in prolonged contact with water to protect your hands. See a doctor. If you have unusual symptoms, if your hands appear red, itchy, or show signs of infection, consult a doctor. People with diabetes should pay special attention to small wounds on their hands to avoid complications. Additional advice: regular dental checkups, at least every 6 months to detect and treat problems promptly. Proper nutrition. Eat lots of green vegetables and fruits. Reduce sugar and foods with high acidity. Drink plenty of water. Avoid dry mouth, especially if you're taking medication. Maintaining proper hygiene habits not only helps the elderly feel comfortable and confident, but also improves the quality of life and protects overall health during the golden years of life.